Hello, and welcome to the second general session presentation in our second day of the 2020 virtual FOP family gathering. This panel is our FOP pain management panel. Each year, we strive to bring new and fresh perspectives to this common topic in FOP management. This year, we're fortunate to have 3 experts who are joining us to share their experience and knowledge in their specific area. Starting us off is Dr. Peter Abaci. Dr. Abaci is the author of Take Charge of Your Chronic Pain, the latest research, cutting-edge tools, and alternative treatments for feeling better. His newly released second book, Conquer Your Chronic Pain, a life-changing, drug-free approach for relief, recovery, and restoration, is already considered a must-read for anyone dealing with chronic pain. As the medical director and co-founder of the renowned Bay Area Pain and Wellness Center, his innovative strategies for integrative pain treatment have helped restore the lives of thousands struggling with pain. Over to you, Dr. Abaci.
Thank you. It's great to be here. Great to be with you guys. Thank you for having me. When I talk to my patients and I talk to them about the comprehensive program that some of them participate in when I do one of my lectures, I often ask them, why are we doing this? Why are we here? Why am I here? Why are you here? What is the purpose of what's the endpoint here? And I think from my perspective, the answer to that, or my goal, is to help people with whatever the chronic pain problem or the challenge is to have a good life. I think you can have a really challenging pain management problem and still have a great life. And all I try to do is I want to help people learn the tools and skills and empower them in whatever ways possible to help that happen. And so what I'm going to talk you through is some of the kind of ideas and philosophies around how I think that can happen. And to start with, I think the experience of pain is so complicated and so complex, but part of that process, the mind-body connection, is all these significant and wholesale changes that take place at the brain level, at the central nervous system level. And what the experience of pain leads to is very significant, widespread, and substantial structural and functional changes in how we're hardwired to work. Part of that happens in the gray matter. Part of that happens in what we call the white matter, which is kind of the cables and cords that kind of help transmit all this information through our nervous system. And what we see is chronic pain leads to significant structural changes in structure and function and how the brain works. And when we're looking at what's going on with all that, what's leading to these structural changes and these functional changes, there's some different sort of components to how we're wired. One is the idea of neuroplasticity, which is that, what's going on in our nervous system and our brains is never static. It's always changing, always evolving. It's an always growing thing. And so neuroplastic changes take place when we are sort of going into an experience or state of being in pain. And then another part of this is what we call neurogenesis, which is our ability to grow and produce new nerve cells and tissues in certain parts of the brain, like the hippocampus, for example. And we know that when we're in pain, our ability to create and produce neurogenesis can be significantly impacted. Another part of this is what we call epigenetics, which is an interesting area of evolving chronic pain research. And with epigenetic changes, what we see is we don't actually change the sequence of the DNA or the genetic sequencing, but we change or can change the way we turn certain genes on and off. And we're learning that with chronic pain, we're seeing these epigenetic changes take place, and research is trying to understand better what ways we can combat that and improve our ability to change. Another part of this interesting brain game is the glial cells. And glial cells are these sort of supportive cells that are surrounding our neurons within our central nervous system and our brains. But not only are they helpful and supportive, they also can play an important role in the evolution of chronic pain and how we experience pain. And they can sort of turn the process on sort of fan the flames, increase the fire of the pain that we experience. And so understanding how they work and how they play is an important part of the process. But when you put all this together, what I think is really cool is, the power, of how we manage this is still within us, inside of us. And we can really do a lot to direct how this evolution changes and the things that we can do to sort of redirect some of these changes away from our pain experience into something much more healthy and wholesome and well. And want to just kind of outline all the different ways that the pain experience, the pain brain affects us and what goes on with inside of us and outside of us. How our mood changes, how we regulate our mood is impacted. Our ability for memory and learning is impacted. How we respond to stress and our stress response significantly impacted by our pain experience. The parts of our nervous system that deal with reward systems impacted. Motivation, decision making. Are we going to get out of bed today? Are we going to leave the house? Are we going to go to work? Are we going to exercise? Things like that. Our impulse control impacted by the experience of pain. Our opinions and judgments, how we feel, how we think about things. Our attitudes. Homeostasis, the way we sort of maintain balance within our bodies, and how we perceive and sense things in our bodies, heavily connected to changes that take place at the brain level. So you start to see what we think, how we think, what we feel, the decisions they make, basically who we are can be so heavily impacted by our experience of pain in so many ways that to really conquer this problem, we have to really come up with a wholesale approach that can kind of dive into all these significant areas that are often part of our own individual pain experience. So we want to, put a plan together for ourselves that will help us create the structural change to the best of our abilities that we can. Talk about using the R's to help us do that. Ways that we can remodel the pain brain, rework things, revise things, reconfigure things, regenerate things, rejuvenate, and then repetition, which I think is maybe not the sexiest part of this, but really important. When you think about how do you create neuroplastic changes and remodel, the way our nervous system works, sometimes you got to keep doing it over and over again. And I often tell patients when they do comprehensive programs with me in my practice, it's not all going to be great after a couple days. As a matter of fact, it might take weeks and months. It might be a process. But if we hang in there and stick with it, we start to see a wonderful evolution take place in our lives. I'd like to share with you what I feel are my five key elements of success. And these are 5 points that you can take with you and with whatever you do with your own doctors, your own medical team, your own healthcare team, in coming up with your pain management plan, your pain management strategies. These are 5 things that you can use to kind of help guide you through that process. First one is mobility. I think mobility is hugely important. And, the quality of our lives is inextricably tied to our ability to get around and go places. And the more mobile we are, the better the quality of life can be. And so anything that we can do to help even just a little bit with our mobility, I think brings value to the pain management plan. Next one is interaction, and the quality of our social connections can be really important in what we get out of our pain management plans. And that might mean both behavioral-based strategies as well as other strategies to help us reconnect and interact in a more positive way with the people around us and our support structure. My third one is independence. Nobody wants to be dependent on other people. We all want to be able to take charge of our own lives as much as we can. So any treatments that we can add to the mix that help boost and improve our level of self-sufficiency and independence with daily activities, I think has real value. Number 4 on my list, which you may not have anticipated, is what I consider validation. And I've been, working with patients for almost 25 years. And one thing that I hear every day, every week from new patients coming in is how alone, isolated they often feel. Many patients feel like nobody understands what they're going through, what it's like to walk in their shoes. How do they really feel? And I think once they start to connect with other people who maybe have shared experiences, I think that's helpful. I think people often feel like their family members don't understand what they're going through. Their doctors often don't really appreciate, understand, or maybe they don't even, believe in some cases. So I think learning ways of communicating what you're going through better with other people helps with that. And I think being able to connect with other folks who have shared experiences is really valuable. And my fifth one, I think my most important one, is love and the power of love. And I think whatever you're doing with your treatments, if whatever it is not bringing more love into your life, then it maybe not be serving the real value that it needs, whether it's medications or other treatments. I think the most core important success that we get out of anything we do with our healthcare and with our pain management is to improve love in our lives. And that means being able to bring love in and also to not push it away. And I think a really fulfilled life is not only to be loved, but to be able to express love for other people. And I think that is the bar that I try to help with my patients. When I'm talking about having a good life, it's one of the key core principles. I like to talk about the storm because being in pain can be such a traumatic experience. When we talk about trauma symptoms, we talk about mood swings, flashbacks, panic attacks, feeling socially isolated, not sleeping well, having nightmares. Those kind of things happen after a while, after we've been in pain long enough. We sometimes talk about the fight or flight response when we're under stress or challenge. We go through this fight or flight event. Some trauma experts also talk about fight, flight, or freeze, which we're so overtaken, so overwhelmed by our traumatic experience of what we might be going through that we can't do anything. We can't act or interact at all, and then we're stuck, and that's not good. I often talk about with trauma and pain that there's sort of three different categories of it. One is once we start to experience pain, if we've had a prior traumatic experience, in life, maybe in childhood or maybe later in life, it can sort of reactivate that traumatic experience through our nervous system. A second type of trauma associated with pain is sometimes the onset of the pain itself, whether it's some type of injury or event may have been traumatic in itself. And then as we start to move forward with the pain that we experience, it constantly gets raveled into these feelings of trauma. The third is what I see with a lot of patients as well, is just being in pain for a long time becomes its own source of trauma. But it's really important that we evaluate, assess for it, when we're working with patients, and that we treat it to the best of our ability. We start to see with trauma hyperarousal symptoms in these different parts of the brain, like the amygdala, hippocampus, the ACC, the insula, thalamus, hypothalamus, all go into this sort of hyperarousal state, and we want to do what we can to calm that down. The organization offers something called the Resilient Living Program, which is designed to exactly help work through some of this hyperarousal and trauma feelings. So definitely be aware of that, and try to tap into that to help with that. It's a really important part of a good pain management strategy. Calming the storm. With my patients, we love to work with meditation, and let's face it, meditation and mindfulness and things like that, one of the hardest things we can do in our society, because we're so overloaded with stuff all the time, and just sort of clearing and cleaning what's going on in our nervous system, requires effort and work, and can be very difficult to start to do. But we know it really helps calm things down. If you need help with that at home, the IFOPA videos have some great resources to help with meditation work. It can be very challenging to get into. Breathing exercises, what induce what we call the parasympathetic nervous system, which is the part of our autonomic nervous system that helps calm us down, helps calm the body down, an important part of good pain management. We use art therapy as well, and the sort of what I call therapeutic creativity, or engaging some of the creative sides of how we process things, can be very therapeutic and very impactful. And there are a couple of different parts of the brain that get stimulated when we're engaging in creative processing that actually reduces pain. The periaqueductal gray and the dorsolateral prefrontal cortex. And the art therapy has been such a huge part of what I've done with my patients over the years. Definitely worth looking at. There are some specific trauma type or PTSD type treatments that can be done when needed. One example is something called EMDR, which stands for eye movement desensitization and reprocessing. It's a special type of treatment. Might be something to look into as well. And just starting to work on the process of reframing harmful thoughts that are not helpful. When they start to change the way we think, it starts to change how we feel. And then the end result is leaving us in more pain, which is not what we want. Some of the big three dangerous thinking processes that we see in pain management. One is catastrophizing, which means when we start to see the worst in a situation, it's kind of the opposite of optimism, or when we think that the worst possible outcome can happen in any situation. There is a movement in the world of pain academics to change that word start using a different word, but I don't know what word that's going to be yet. But for now, we know that high levels of catastrophic thinking leads to or correlates to being in more pain longer and needing stronger pain medications. Fear is, I like to say, is your evil, wicked stepmother in your pain management story. And I think that, fear is an example of how being in pain can play all kinds of games with how we think and how our brains work. And starting to understand when we're developing unhealthy fears that hold us back, fears that keep us in a box, stand in the way of helping us get better and live a more meaningful and fulfilling life. Those are the fears that we want to understand and overcome. Sometimes it's hard to see them in ourselves, and sometimes we need help. With my team, we use our behavioral health team, we use our physical rehabilitation team, we use our medical team. Everybody tries to help patients work through this, because the first step is always identifying which fears are standing in the way of our success. The third one is anger. And when I talk to anger with my patients, I always say, you got a lot to be mad at. You're in pain. It's not your fault. Maybe you're upset with, your insurance company not caring about you. Maybe your doctors or healthcare is not doing a good job. You're experiencing pain that is not your fault. There's a lot to be mad about. But you got to, at some point, get past that, let that go, because when you're full of anger, what are you pushing away? You're pushing love away. And remember, that's the ultimate goal. So that's another sort of thought process that we have to start to work through. And then there's different ways of kind of working through, washing away some of the negative thinking patterns and starting to shift towards a more healing mindset. One is acceptance, and we could have like a whole conference on acceptance for sure. And I'm not going to go into a lot of that today. We don't have time for that with my talk. But I always like to say acceptance is not giving up. It doesn't mean that you're giving into your medical condition, your disease, or the pain that you experience. It means that you recognize it for what it is, and that you're going to put it in a box, and you're going to handle it, and you're going to move on with your life in the direction that you want to go. Gratitude, is so important to our well-being, and it helps us heal, energize, and transform lives. Helps us feel better, sleep better. It just improves our quality of lives. But research also has shown that when people are in pain, they have an especially difficult time connecting with gratitude and feeling gratitude, which means we have to go the extra step, the extra mile to bring gratitude back in, and using gratitude exercises, writing something down every day, however it works for you. But you have to consciously shift towards gratitude to get its full benefit. And likewise, compassion, also very important. Being compassionate is when we're responding to the needs of others and people in need or others in need. And research seems to show that helps boost our own well-being. And when we're in pain, that can be more difficult to do. So it's really important that we go through a process of trying to bring that back in. One way of doing that is something called counting kindness, where you just write down one or two things maybe that you've done that's nice for somebody every day. Research shows that doing that even for a week can start to shift us into a more compassionate mindset. And the organization offers something called an Ability Toolbox program that can help with these types of things as well. Definitely look into that as a resource. These are really important things. We use exercise in my practice a lot, and I think the take home with it is exercise stimulates important parts of the brain that are impacted by pain, and however we can move our bodies in safe and healthy ways is going to help us feel better. Another interesting thing is the gut-brain connection, and what's going on in our brains and what's going on in our gut and the bacteria, what we call the microbiome in the gut. We're starting to learn more about this communication between the brain and the gut, which is really interesting. A lot more research will come with that. But when we're talking about the pain brain and the experience of pain, I think we're going to start to learn and see what's going on with the microbiome in the gut and the brain is. We're going to learn more and more about that. As research unfolds. But one thing that I like to train or teach to my patients or talk about is what I call the rule of 7. And my rule of 7 is every day try to have 7 different types of fruits or vegetables in your diet. And I think that can be a great way to improve your gut health, which will help boost all the other important things that you're doing with your well-being. So I think the biggest complaint that I often hear besides pain from my patients is that they don't sleep well. And we know that sleep is so important to good health and also really important to pain management. And research has shown that when we don't sleep well, we hurt more the next day. And it seems to be a strong connection to how we manage our pain. So learning effective sleep hygiene tools, little ways and techniques and strategies of sleeping better is going to be really important. If you're still having a really hard time, we often use something called CBT for sleep, which stands for cognitive behavioral therapy. Research seems to show that CBT works really great in helping people improve the quality of their sleep and works even better than medications do. Pretty much most of what I've talked about, if you're interested in diving a little bit deeper, you can find that in my second book on Amazon, Conquer Your Chronic Pain. It's been awesome to be able to share a little bit of that with you today. I'm going to turn things back over to Hope, and thank you.
Thank you so much, Dr. Abaci. The first time that I heard Dr. Abaci present, I knew that he would be a great fit for the programs that we already offer here within the IFOPA. So if you haven't already checked out our Resilient Living booth in the exhibit hall or our Ability Toolbox booth, those both connect to several points that Dr. Abaci brought up in his presentation. And we hope will be a part of your this really comprehensive, empowering, and personal approach to managing pain moving forward. I did want to address a question came in that asked if any of these pain presentations are specific to children. Or cover pain management for children. And I would say that while none of them are specifically speaking to children, they all can apply. Certainly the concepts that Dr. Abaci and the rest of our other 2 panelists have shared. So next is Dr. Debra Kimless. Dr. Kimless is a board-certified anesthesiologist with a subspecialty certification in pain medicine. Dr. Kimless entered into the medical cannabis field in 2013 to learn if cannabis was an option when her mother was suffering from intractable pain. She consults within the industry as the Chief Medical Officer for Pure Green Pharmaceuticals, the Medical Director for Forward Grow, a medical cannabis cultivation and processing company, and the Chief Science Officer for Merida Capital Partners, the Director of Research, as well as the Director of Research for Laurel Harvest Labs in collaboration with Temple University. Dr. Kimless is considered among a few expert physicians who understand the power and importance of the endocannabinoid system. As the Chief Medical Officer for Pure Green Pharmaceuticals, Dr. Kimless conducts IRB-approved clinical trials using Pure Green Pharmaceuticals' patent-pending sublingual tablet formulations and takes the data obtained from these trials to the FDA to support clinical trials. She presents the data and results at national and international conferences and seminars. Dr. Kimless, we're excited to welcome you to the stage.
Hi, thank you so much for inviting me here today, and thank you to the participants of this conference to give me this opportunity to share my passion for alternatives to traditional pharmaceutical therapies. So we're going to begin. Is talking about cannabis as medicine. And the lawyers make me write this. And so, as Hope stated, I'm a participant in many different touch points within the cannabis industry, which is really important because it helps me to inform exactly how patients access cannabinoid medicine and understand what is important for them specifically. And so I was asked today to discuss some different goals, one of which is to describe something called the endocannabinoid system, something that I never learned about in medical school, and we'll go into that in depth. Also to discuss how chemicals in the plant, in the cannabis plant, interact within our endocannabinoid system, and talk about the differences between plant cannabinoids or the plant chemicals versus the chemicals that are synthesized in a beaker or test tube, otherwise known as synthesized cannabinoids. Discuss the differences and define THC and CBD, and then talk about the methods of consumption, how we actually assimilate or take cannabinoids and why it matters. So we have a lot to cover here. So in 2013, when my mom was dying from the side effects of a pharmaceutical, and my mom was in horrific pain, and sadly my mom was the kind of person who was unable to take traditional pharmaceuticals without horrible adverse effects, I started doing a deep dive research into cannabis as a potential therapeutic for my mom. Sadly, she didn't live long enough for us to try it to see if it would be even an option for her. But when I was investigating cannabis as medicine, and I went to Israel, I went to the Netherlands, I studied in master programs and went around this country as well to learn about cannabis as medicine, I noted that in states that have legal programs, and even to this day, there are many, many different conditions for which cannabis is used. So cachexia and wasting syndrome, anorexia, which is the inability to eat, severe nausea, severe or chronic pain, seizure or epilepsy, severe persistent muscle spasm, glaucoma, post-traumatic stress disorder, anxiety, depression, autism, cancer, either as a primary treatment or for symptoms related to cancer treatment, veterinary medicine, opioid and other substance use disorder, inflammatory bowel disease, other autoimmune illnesses, sleep apnea, and other sleep disorders. And when I first embarked upon this study of this, I'm a traditional allopathic physician, an MD, went to medical school 100 years ago. I was never taught about cannabis as a medicine. And so when I embarked upon this, I thought, how could a single plant take care of all of these different and seemingly disparate illnesses. And so I thought, is this really snake oil? Is this really sort of a nudge, nudge, wink, wink, legal affirmation to get high? And because when I grew up in the era of Just Say No, where they had a whole campaign basically saying this is your brain and this is your brain on drugs. And so I myself actually believed in it. I actually believed in the advertising campaigns. And so I never had a personal experience with cannabinoids prior to understanding in my own research. And in this research, my aha moment, my brain expanding moment was that we had something called an endocannabinoid system. Endo means from within, and cannabinoid means is that our body has a system of chemicals that communicate within ourselves, but also the plant interacts with it. And so the overall reason for this endocannabinoid system is to maintain homeostasis, which is a fancy word for to maintain physiologic balance. And our endocannabinoid system interacts with basically every other biologic system in our bodies, from thinking to pooping and everywhere in between. Life as we know it wouldn't even exist without an intact endocannabinoid system. So if this is such an important system, why is it that pretty much no biology class teaches it, certainly not in high school and college? Less than, I think they say 14% of all medical schools even discuss the endocannabinoid system. And when they do, the majority of it is in an elective program. Could you imagine this important biologic system as only an elective? Could you imagine if we just said, cardiovascular system, we're just going to teach that as an elective? But the reason why this is such a new phenomena is that different from an organ-based system where you can actually cut open a body, take a look at a heart and a lung and a circulatory system, and different from a cellular-based system like our red cells and our white cells and our immune cells where you can look under a microscope, the endocannabinoid system is a chemical-based system. And it took a really long time for very smart scientists, both in the United States and in Israel and around the world, to identify and describe it. And still to this day, the mechanisms and the receptors and the interactions of this endocannabinoid system are still being identified. But I want to share with you now some of the basics of the endocannabinoid system as they are characterized so that you have an appreciation for the endocannabinoid system. And you will know more, most likely, than most of the physicians and healthcare workers that you will encounter. So their endocannabinoid system is really broken down into three parts. One is something called the endogenous ligands. That's a fancy term for the chemicals that our own body makes. One of which is called AEA or anandamide. Anandamide was first described and characterized in the in the mid to late 1980s by Dr. Raphael Mechoulam, and he called it anandamide for bliss molecule. Later on in the 80s, they found 2-AG, 2-arachidonyl glycerol. Other part of the endocannabinoid system is something called receptors. They act as docking stations where these chemicals interact. One is called CB1 receptor, cannabinoid 1 receptor, and we'll describe that in a second. The second one is called CB2 receptors. These are the most characterized receptors. There are many, many other receptors that are being identified as I'm speaking right now by smart scientists, but these are the ones that are most characterized. And then enzymes. These are proteins that make and break down AEA and 2-arachidonyl glycerol 2-AG. So let's first describe the receptors and why they're important. So receptors are docking stations within our bodies where chemicals interact that turn on or off activities. There are all kinds of different receptors in our body. CB1 receptors are cannabinoid 1 receptors, part of our endocannabinoid system, are found predominantly in the brain, the central nervous system, and the peripheral nervous system, but also found in organs around our entire body. And when our own endocannabinoids and or the plant cannabinoids interact with certain areas within our brain, it turns on and off effects. And let me give you an example. So for example, I'm sure that people have heard that if somebody is smoking cannabis, they get something called the munchies, where suddenly they feel this intense desire to eat. Well, that's because it turns off an area or receptor in the area called the hypothalamus that is involved in appetite. And it's kind of funny, like where you sit and you watch people eating a whole bunch of things that may not be exciting for you to eat. But if you're somebody who has severe anorexia or wasting disease, either from something like HIV/AIDS or something from chemotherapy, you can imagine but stimulating the area in the hypothalamus would be life-saving. Same thing with an area in the medulla that has something called the chemoreceptor trigger zone that is involved in nausea. Again, somebody who's taking life-saving chemotherapy who suddenly can't eat because of severe nausea, and they're like laying in bed because they're paralyzed by this, preventing this nausea and vomiting is life-saving. Same thing with basal ganglia. That's an area that is involved in movement. People with Parkinson's disease may be struggling horrifically with the ability to move. Stimulating that area may allow somebody to move effectively. And someone in the area of the cerebral cortex may have horrific post-traumatic stress. I mean, I know that people laugh about, dude, where's my car with cannabis? But somebody who has memories that affect their ability to sleep or to even conduct themselves on a daily basis, to extinguish those memories could be life-affirming. The interesting thing, though, about the CB1 receptor is that the area in the spinal cord high up, there is not a lot, or if any, of these CB1 receptors, different than an opiate receptor that is plentiful in the area of the cardiorespiratory area. There's hardly any CB1 receptors at all in that area. Why is that so important, and why did I call that out? Because if somebody overconsumes cannabis or cannabinoids, they may feel uncomfortable and feel like they want to die, but they won't stop their heartbeat and they won't stop breathing, like if you overconsume opiate medicine. So that's what makes cannabis for pain management very interesting, because overconsumption may make you feel the opposite of comfortable, but at least it won't cause a life-ending event. CB2 receptors are these other receptors that we described. They're found predominantly in the periphery on immune cells, but can also be found in a brain that is injured or on other organs as well. But it decreases inflammatory responses. Inflammation is an area that we as pain medicine doctors know that when you have a chronic inflammatory process, reducing inflammation is a very good pain relieving mechanism of action. And that is one way that cannabinoids, by interacting with these CB2 receptors, can also help in reduction of pain, amongst other things, improvement of a lot of other immune-driven medical conditions. And then I talked about enzymes. These are proteins that make and break down receptors. This is just for completion, but MAGL and FAAH are two enzymes that break down 2-AG and anandamide respectively. And these are areas of interest within the pharmaceutical community because it's easy to sort of target a specific enzyme rather than a receptor to try to improve circulating 2-AG or circulating anandamide that interact with our CB1 and CB2 receptors and try to increase this. The interesting and weird thing about these endocannabinoids is that they are made on demand, they're used locally, they're rapidly broken down, and they're not stored. And so by increasing the circulation of these will allow for their effects to last longer. And so I want to just briefly go over the endocannabinoid system again. We have in the beginning the endocannabinoids themselves, anandamide or EA and 2-AG. They're made on demand. They're used locally. They're broken down rapidly and not stored, which is very different than any other neurochemical or neurotransmitter in our bodies. They interact both with CB1 and CB2 receptors. And CB1 receptors are predominantly in the central and peripheral nervous system, the brain and peripheral nerves. CB2 receptors are predominantly seen on immune cells, but also found in our body's organs as well as in the brain when the brain is either under a physical stress due to a trauma or emotional stress like a post-traumatic stress syndrome. And the interesting thing about cannabis is that cannabinoids interact within our endocannabinoid system. And so the cannabis plant is literally a chemical manufacturing factory. It makes over 400 different chemicals. About 100 of them are specific to the cannabis plant itself, meaning you can't access those chemicals from eating other plants. There are over 100 terpenes in this plant. So if anybody's ever smelled cannabis, it smells pretty distinguishable. And it's from these different chemicals called terpenes. These terpenes are not only responsible for scent, but also responsible for a lot of bioactivity. Flavonoids, which are potent antioxidants and anti-inflammatory molecules, provide for the color of the plant as well, but not unique, except for two, to the cannabis plant. Canflavin A and B are found uniquely in the cannabis plant. And the interesting thing about this is that with all of these potent chemicals, intoxication, that high that made this plant illegal, is only found in a couple of different molecules within this plant. And this plant was vilified for a long time, hundreds of years in this country. In fact, cannabis up until the 1940s was found in our U.S. pharmacopoeia. My grandfather, who is a pharmacist back in the 20s and 30s and 40s, probably made cannabis tinctures in his pharmacy to help with medical conditions. And yet intoxication is found in yet a few of these chemicals. I think we're all familiar with THC, tetrahydrocannabinol, as being that intoxicant. That's one of them. THCV, tetrahydrocannabinoid-virin, which is a variety of THC. It's a genetic variation of it. CBN, which is a degradative product of THC. It's not found in the plant as it grows, but it's a degradative product that can cause intoxication. And yet that's it. So I'd like to talk a little bit about the plant, although this looks like an odd version of what that plant looks like. But it's a very important slide to talk about cannabis, the plant, and how it grows in nature. So as the plant grows in nature, it grows and it makes a chemical called CBGA, cannabigerolic acid. CBGA is known as the mother of all cannabinoids, and enzymes quickly convert the CBGA into THCA, CBDA, and CBCA. These chemicals have that letter A, which is an acid form of those chemicals, not acid as it burns you. It just has something called a carboxylic acid. And the interesting thing about cannabis in its raw form is that you can eat cannabis all day long. You may get a bellyache from all of the fiber, but you will not get that intoxicating effect when you inhale. As you do is if you inhale it, as you heat it, it takes time and temperature in order for those chemicals in its raw form to be converted to THC, CBD, and CBC. Very interesting. So the plant, as it grows in nature, doesn't have that intoxicating THC effect. Doesn't even have CBD in it. It's not until you apply time and temperature will those chemicals get converted from CO2 and water from THCA, CBDA, CBCA to THC, CBD, CBC. And sadly, just like the rest of us, as it ages, it does degrade. It degrades to chemicals known as delta 8 THC or CBN or CBL. However, all of these chemicals, not just the heated forms, have tremendous bioactivity. So the raw forms of these plants actually have tremendous bioactivity, just like the heated forms of these plants, as does the aged chemicals of this plant. But that's not all. This plant has what I described earlier as terpenes. Terpenes gives this scent and the taste to this cannabis plant. And the cannabis plant is sort of like humanity. Not every cannabis plant is the same. It has different combinations of these different chemicals, including some plants have different chemicals, including higher amounts of THCA. Some plants have higher amounts of CBDA, but yet the bioactivity is changed and altered not only by the THCA and CBDA, but also by these terpenes. And so I don't know if anybody's ever gone into a pine forest and taken a deep breath and you feel like, oh my God, my head is cleared and I can take this deep breath and I can conquer the world. That is from the terpene pinene. It is hugely anti-inflammatory. It bronchodilates. It's antibacterial, and it is also found in some of these cultivars, also known as strains, in cannabis plants. Linalool, which is in lavender. I don't know if anybody has sprayed lavender or breathed in lavender before they go to bed, but it is a very strong anti-anxiety and relaxer, but it has pain-relieving effects and anti-nausea and vomiting effects. So you would look for a cultivar or strain of cannabinoids that has linalool in it. Beta-caryophyllene is hugely anti-inflammatory and pain-relieving. An interesting thing about this terpene, which is found in pepper, is that it sits on the CB2 receptor. Remember that cannabinoid receptor that's on the immune cells that decreases inflammation? This terpene should probably really be considered a cannabinoid, and there's discussion in the cannabis world about that. Myrcene is found in mangoes as well as hops. It is found in many, many different cannabis cultivars. It's a huge muscle relaxer and wonderful for sleep aids. Limonene is found in citrus fruit, again, anti-anxiety, antidepressant. And when I initially brought up the disparate medical conditions that cannabinoids in our endocannabinoid system interact with, it's because this endocannabinoid system is involved in all of these different medical conditions, all these different bioactivities, from thinking to pooping and everywhere in between, but also these chemicals interact in different ways and together to make up this pain-relieving methodology as well as other health conditions. I was asked to talk about the difference between the cannabinoids that are found in the plant versus synthesized or synthetic cannabinoids. Now, there are two FDA-approved synthetic cannabinoids. One is known as marinol and the other is sesamet. These are purified THC that is made in a beaker. I want to impress upon the listeners that a molecule is a molecule is a molecule. The THC found in these iterations are the exact same molecule found in the plant. The difference is it doesn't have all of the other constituents found in the plant. And it is believed that the other constituents found in those plants allows for a synergistic effect. In the cannabis world, they call it the entourage effect. In the medical communities, we call it synergism, where you use the bioactivity of lots of different chemicals so that you're not just using a whole host of one specific molecule, that therefore you can get adverse effects. So when you take marinol or sesamet by itself and it's not balanced out with a lot of these other chemicals, you can feel the uncomfortableness of THC by itself. You know, these chemicals in this plant has sort of this duality. A little bit of THC or a little bit of CBD can reduce anxiety, reduce depression, allow for sleep. Too much can cause excitement. Too much can cause anxiety. Too much can cause nausea and cyclical vomiting. And so that's why there are many people in the arena of look at this as not being comfortable. There are some plant-derived pharmaceuticals, but they have synthesized out those other chemicals. So I just want to impress upon you, a molecule is a molecule. CBD and THC are the same. CBD and THC are the most popular of these chemicals. CBD tends to be non-intoxicating, THC intoxicating, yet both have very, very potent medicinal properties. And because of that strategy of the raw versus the heated, the method of administration actually matters. So if you inhale and you heat it, you don't access the raw cannabinoids. So by combusting, by smoking, or vaporizing by heating to a steam, you only get the heated forms of the cannabinoids. There are inhalers coming out that you like a puffer for asthma that may allow for the raw cannabinoids. Sublingual or buccal goes under the tongue that allows for it to be administered as processed. So if you want raw plus heated, you can get both. It lasts a little bit longer than inhaled. Oral is a swallowable, oral ingestible form. The challenge with that is that it has to go through the digestive system. It gets hit by hydrochloric acid in the stomach, and then it gets taken up into the liver. You only get about 8% of what you've taken, so it's kind of inefficient. It takes somewhere between 60 and 90 minutes before an oral preparation kicks in. And even then, it is metabolized, and you're only accessing the metabolite of it. The good part about it is if you can find your dose, it's long acting, somewhere between 6 and 8 hours. The challenge with an oral administration is sometimes if you eat oral THC, it can be way more intoxicating than if you smoke it or put it under your tongue. There are topicals or transdermals. Topical means that if you can touch it, that's where it works as a topical. Transdermal means that they use the skin to absorb it as a vehicle for administration. And then rectal or vaginal, there's lots of blood vessels that can allow for systemic absorption for that as well, in addition to being treated sort of topically either in the rectal or the vaginal areas. So we have gone through a lot of different things today. We've talked about endocannabinoid system, the chemicals within our endocannabinoid system, the receptors and how it acts and where it acts. We talked about cannabis as a plant and that it interacts with our endocannabinoid system as well, as is the chemicals in a synthesized and the differences between the synthesized pharmaceuticals versus the plant, and some methods of administration. This is normally an hour and a half talk, so I'm sure there'll be lots of questions, and thank you very much for listening. Hope, back to you.
Thank you very much, Dr. Kimless. That was a wonderful presentation, and I know there are questions. I do just want to say that the specific reason that we reached out to Dr. Kimless, who did such an amazing job of explaining this, is because we understand that accessibility and the legal use of cannabis varies greatly, not just from state to state here in the United States, but also from country to country. So we hope that this was really an educational session to help you understand how you could, how this plant works. Up next, we're going to hear from Karen Harrison. So Karen is a senior licensed Reiki master teacher with the International Center for Reiki Training and teaches all levels of Holy Reiki, Holy Fire Reiki. She began studying Reiki in 1993 and has studied with several ICRT teachers, along with several Japanese Reiki masters. Karen was kind enough to take the time to collaborate with a member of the FOP community who is the mother of an adult with FOP and who has used Reiki. And we're so grateful to her for taking the time to learn more about FOP. So over to you, Karen.
Thank you, Hope. Appreciate it. Okay, I'm trying to advance to my slide. Okay. Well, my first slide didn't show up, but that's okay. All right, so let's start off with what is Reiki and how can it help me? And my website is www.karenharrison.net. Okay, just having a little bit of trouble advancing. Okay, so Reiki is all about reducing stress, and it's one of the most important issues to achieving and retaining good health. And also, we've been talking a lot about pain, and Reiki is great for pain. Okay, so Reiki session helps to clear layers of stress and blocked energy, helping the body to function better. Okay, let's begin by defining Reiki. Reiki is a Japanese technique for stress reduction and relaxation that promotes healing. You can also consider it spiritually guided life force energy or a complementary therapy. And it helps to promote the relaxation response in the body. Okay, Reiki complements traditional medicine. It provides physical, mental, emotional, and spiritual support, and it induces the relaxation response, which is the rest and restore response, rather than the fight or flight response. Some of the benefits of Reiki is it creates deep relaxation. Oftentimes when people come into my office for a Reiki session, they come in due to pain. And Reiki is very good at helping to relieve pain, helps the body to release that accumulated stress and tension, and it accelerates the body's self-healing properties, which helps you to sleep better. Many people report sleeping much better after a Reiki session. It also can reduce blood pressure. It helps chronic problems like asthma, back pain, headaches, and so forth, depression also. It helps to cleanse the body from toxins, and for those patients undergoing chemotherapy, it can help to reduce the side effects of the chemotherapy, like the nauseousness. It helps to support and boost the immune system, and it helps people to be in touch with their spirituality and emotions, and helps to clear out layers of blocked energy. And one of the best things about Reiki is if someone takes a class, then they can learn to give Reiki to themselves, which helps them to feel more in control of what is going on with them. And clearing out old trauma. I'm also a marriage and family therapist and licensed professional counselor, and I've worked extensively with all kinds of trauma, whether it be from illnesses or accidents or some sort of abuse. And I found that I've gotten much quicker results with Reiki than with many of my counseling techniques. So I spoke with Lori Danzer, who's a member of your group, and she used Reiki on her daughter with FOP for 12 years. And what she reported to me is that Reiki helps her with pain, with relaxation, with sleep, with headaches, anxiety, and spiritual healing. And Lori used Reiki for other FOP patients as well. And she was able to help the spasms to stop. And the person was able to get off their pain medication, which is, very significant. If you don't have to deal with the pain medication and all those side effects, that is a huge benefit. So Reiki is safe. It complements and will not interfere with the doctor's treatment. It's spiritual but not religious. You don't need to have any particular beliefs to learn and practice Reiki or to receive a Reiki session. So the philosophy of Reiki, this is all the dogma there is, which are very helpful life principles. Just for today, I'll let go of anger. I'll let go of worry. I will do my work honestly. I will be grateful for my many blessings, and I will be kind to every living being. So here's some evidence that Reiki works. As of 2020, there's 85 articles published on Reiki research. 4 didn't show support for Reiki, 10 show preliminary support, and 30 show Reiki is effective for acute and chronic pain. A big deal in the FOP community. Stress, depression, and anxiety, practitioner well-being and relaxation, so that would be the person giving the Reiki, which could often be a family member that has taken a class. The pain and well-being in patients with cancer and chemotherapy. And then those remaining studies were not well designed. So some of the benefits for patients and caregivers. For patients, it reduces stress and anxiety. It promotes feelings of control and engagement with their own well-being, giving them a sense of there's something that I can do. Here I can request Reiki, or if I'm trained in Reiki, I can give Reiki to myself. It promotes trust between the patient and caregiver. So if you have a loved one giving you Reiki, that is going to help to increase the bond and reduce that caregiver-patient kind of stress that happens. It also allows for reduced need for medication with fewer side effects and toxicities, and possible shorter recovery times. I've seen that happen many times. One of my clients had some breast surgery for cancer where she had a total mastectomy, and she reported to her doctor that within even a few days she was out walking, and she'd asked when she could drive again, and the doctor said, well, when you've been off your pain medication for a certain period of time, and asked her when the last time she had taken it, and it was 2 days after her surgery, and after that she didn't feel the need for it anymore. So the doctor was quite amazed at that. So for caregivers, it reduces stress and burnout, promotes a positive sense of well-being and a sense of competence, because as a caregiver, you want to help your loved one reduce their pain. And if you have something that can help them with that, then that's going to help you to feel better and more in control. So some more evidence Reiki works. It's shown to be as effective as cognitive behavioral therapy to reduce depression in adolescents. A Reiki group had 4 hours of Reiki, where the cognitive behavioral group had 36 hours. And I kind of joke that, a depressed teenager, would they rather come lay on a table, fall asleep, take a nap, and do nothing? Or would they rather go through 36 hours of cognitive behavioral brain training? Okay, right. Reiki is shown to reduce pain, need for pain medication, and length of hospital stay after knee replacement. One of my colleagues wrote Reiki in Clinical Practice, a science-based guide by Ann Baldwin, PhD. A 10-minute Reiki treatment improved range of motion and reduced pain in people with shoulder issues. And then there was an experiment with rats too, who, are not able to alter the effects of a treatment. So it showed some good results with them. So a typical Reiki session can be laying down on a bed, on a massage table, on a couch. It can be given hands off or hands on. And a Reiki session feels like a warm, glowing radiance. Here is a chart of typical hand positions, and I'm sorry it's not more clear, but basically these are positions for treating self and others that start with the head and work down to the shoulders, the chest, the solar plexus and stomach area, and then the person can turn over and treat the back also, ending with the feet. And then there's also positions for treating yourself. And that's actually something that I do every day, is give myself Reiki so that I can feel and be at my best. Okay, Reiki can be focused on a problem area, or you can also scan the body to find an area that needs treatment. Reiki practitioners are trained to develop sensitivity in the palm of their hands, and then you can scan over the body and see where there's blockages in the energy field. And this is something that I've been using for myself lately because I discovered that I had an ear infection. And the doctor told me, okay, take those antibiotic ear drops for 2 weeks, but I could feel the blockage isn't gone. So I know that, I need to take it longer in order for that to be cleared up. So scanning is something that is giving me some feedback about what I need to do for my own health. And then it also helps me to know where on a client to work. So patients can take a class and give themselves Reiki as well as their caregivers. In the Reiki community, we have a goal of one Reiki practitioner in every family so that a family member can give Reiki to any family members in need, including pets. You can also give Reiki to your pets. And one of my students gives Reiki to her dog to help stop seizures. And that's pretty amazing. She said that it dramatically reduces the amount of time that the dog normally has a seizure and helps the dog to be calmer and come out of it much quicker. As a caregiver, you can give Reiki to yourself to protect from burnout, because it can be so stressful to be caring for loved ones with pain and all sorts of difficult health problems. So giving yourself Reiki is a wonderful way to support yourself. So Reiki, like prayer, works at a distance. Many of the sessions that I do over Zoom or over the telephone. I can provide Reiki anywhere, and it works equally well at a distance. Okay, how does Reiki heal? All you do is activate the Reiki healing energy and place hands on the person or intend to send it at a distance with the intention of healing. The Reiki energy directs itself. It won't cause harm or pain. And the Reiki is smart energy. It goes to the part of the body, usually nearest the hands, that needs it the most or that has a block. And a Reiki treatment increases your life force energy. It removes blocks that can cause ill health. And it raises the vibratory level in and around the body where the negative energy is, which causes it to fall away. A little bit more about how Reiki heals. It flows around the organs and tissues. It enhances the healthy energy while seeking out the unhealthy energy. It flows directly to it, around it. It breaks it up. It removes its negative programming. It transmutes it into healthy ki, which is energy. And it can seem like it's just releasing it as one big chunk. I had a client with breast cancer, and while giving Reiki over her breast, she said that she saw a big dark cloud release from her breast. And, between the Reiki and the medical treatments that she was receiving, she was shortly healed after that. So by removing the unhealthy ki, which is the unhealthy energy, the natural flow of the healthy ki is restored. And Reiki provides a higher level of nurturing to the body. And it works on the mind, emotion, and spirits, helping us to feel better. So let's try feeling the energy. Everybody has the ability to access healing energy. Only those who have taken a Reiki class and received the Reiki attunement are actually practicing Reiki, but everybody has the ability to do that. So place your hands together. You might try rubbing them a little bit, call on healing energy from source, and place your hands on your body and feel the warmth from it. So how can you try out Reiki? I have an online Reiki circle that meets on Zoom. It's open to anyone. It's the second and fourth Mondays of the month at 7 p.m. Central. You can get access to that by emailing me to Karen@KarenHarrison.net, and I'll send you a link. And Reiki Circle is free. You can schedule a private Reiki session with a practitioner, and you can find a lot of Reiki practitioners on www.reiki.org. And you can also try out Reiki at a class. So this is a picture of a class in my home. So who can learn Reiki? Anyone can learn Reiki. I've taught people age 4 up to 87. And then who can teach Reiki? A Reiki master teacher. And the beginning class is Reiki 1 and 2. It's a 2-day class. It's comprehensive. My classes are 9 a.m. to 6:30 p.m. So it's full of lots of information about how to give Reiki to yourself, how to give Reiki to someone else, how to scan, and how to clear your energy field. Okay, the medical profession is taking note. Reiki has been featured on Dr. Oz. And Reiki is now available in some major cancer centers and hospitals. Some research that the International Center for Reiki Training did is they found that there were Reiki programs in about 800 hospitals around the U.S. And Reiki has also been featured in Newsweek, and most recently today, I think it was USA Today, I saw an article on that. And you can check that out on the Facebook page for the International Center for Reiki Training. So our dream, Reiki in all hospitals and in every family. So allow Reiki to support you in your path. You know, you can give it a try. Lori Dancer in your community is a great resource for you. I would be glad to answer questions for you and, see what Reiki can do for you as a patient or as the caregiver or family members. So thank you so much for inviting me to come speak with you about Reiki and the wonderful healing power of Reiki.
Thank you, Karen, for that wonderful explanation. I know it was a new topic for me to learn about, so I hope that everyone in our audience learned something new as well. And we do just have a few questions in, so if you have a question, please go ahead and submit it through the chat or the Q&A feature in that lower left side panel. But both of these questions right now are directed towards you, Dr. Kimless. So the first question is, are there many places that you can buy the purified terpenes? Did I pronounce that correctly?
Yeah. So it's very interesting. So you access terpenes by eating fruits and vegetables all day long. And so terpenes in and of themselves have bioactivity. No one has ever really delineated how much extra purified terpene you can get. But yes, if you go online and you Google, terpenes, you can buy them. Just be very careful because they're strong, and too much of a good thing is not a good thing, and can lead to an allergic reaction or an anaphylaxis. You have to be very, very careful with it. In the plant itself, less than 2 to 3% of the entire plant mass is made up of terpenes. So again, you have to be very cautious when you use them.
Thank you. And another question. So would you advise CBD or THC for children? And in what form and from what age are there guidelines?
Right. So kids are very special. And so the question is, it's a balancing act between what their medical condition is, what are the traditional alternatives and the side risk-benefit ratio of that versus what's the risk-benefit ratio of cannabinoid treatment, and then treat that child comprehensively. And so I do that not just with kids, with actually everyone. And in my personal guidance with patients, for transformation, we change their diet to a whole food, all plant diet for their gut microbiome health. And then we look at a therapeutic order of what makes the most sense with the most efficacy with the least amount of side effect. And so that's a long answer to yes, children can certainly respond well to cannabinoids. We would have to think about what the condition is that we're treating, and then start with the lowest level of cannabinoids once we get their diet straightened out, once we see what other traditional therapeutics are doing and what their conditions are, and then slowly titrate up the cannabinoids. Methods of administration, I'm agnostic to. I'm imagining that we're not going to allow for inhalation for smoking or vaping, but when there comes a time when a vaporizer, like an asthma vaporizer, becomes available more broadly, that might be a method of administration that's easy and understandable to certain kids as well as adults. A tablet or an oil drops under the tongue, or even capsules or tablets swallowable, may be something that would be a benefit. If it's a localized pain, a topical is amazingly well received with very, very minimal side effects. So again, it depends upon what we're treating, what the location, what are the other treatments going on, and we have to look at it holistically, everyone, children as well as adults.
Thank you. Dr. Abaci, a question came in for you. And then I'm also curious to know, do you, in your book, it seems like it may be a little more easily accessible for adults, but do you ever have pediatric patients who you work with to use your philosophy or your practice?
I don't treat children in my own practice, but I will say a lot of things that we talked about today work great with kids. Art therapy, the art therapy world is hugely successful with kids in many ways, in processing grieving and all kinds of things. Kids learn meditation really well. A lot of local schools in my area, started bringing that in several years ago, and I think it's worked really, really well. I think a lot of the things we talked about, kids like to have fun, and I think if we can make it, if we can do them in a fun way, it's gonna resonate.
Great. And that's actually a perfect segue into the next question that came in for you, which is, do you have any tips? This is from an adult. Do you have any tips on how to start with meditation? So is there an app that you would recommend, or what practices? I know it can be kind of intimidating to begin meditation. So what tips do you have for someone who's new to that?
Yeah, I go through this challenge with people all the time. So I think it always helps to put it on your schedule. However you keep your calendar, mark out a little bit of time. I think it also helps with anything new is to start small. Maybe just devote a couple minutes for the first day or first couple of weeks. And then, as far as tools that you can take advantage of, there are a lot of, popular great apps out there, from, Headspace to Calm. I have a series on an app called breathe.com, a pain management series with some meditations in it. And so they're easily accessible on the phone now, which is nice. Of course, part of being a good meditation practice, or having one, is unplugging. And so, that it kind of runs counterintuitive a little bit. I think if you're interested in finding resources to read, of course, the kind of father of a lot of modern meditation mindfulness is Jon Kabat-Zinn, and his book Full Catastrophe Living, and there's a lot of other great resources out there. But I think it's the first step is to put it on the schedule and stick with it, and start small, and build on it from there.
Great. Thank you. And I can see we've had one more question sneak in the chat. So Dr. Kimless, can you recommend a topical cannabis product?
So the answer is I can't. So the challenge is that, at least in this country, every state has its own rules and regulations as to what is accessible and what is not. And so therein lies the problem. And in fact, I think it's a human rights issue, quite frankly. I would start, if you have access to it, with the least common denominator, which is probably the easiest to get, which would be a CBD, hemp-derived CBD, and see if that works. I'm not vilifying THC. It's just that oftentimes it's very, very difficult to get, very expensive, and a lot of difficulty. You have to find a physician to write a recommendation. You have to become a patient or a caregiver. And so I would start with that. I would look for companies that have certificates of analyses. These are real live lab reports that actually show that what is in your product is actually in it. There's lots of studies, sadly, out there that show that a lot of over-the-counter CBD products, not just topical, but oral ingestible as well, it doesn't even contain CBD. Or if it does, it doesn't have the amounts that it says on the label. So I would look for a company, preferably a hemp-derived, preferably a full spectrum, that comes along with a certificate of analysis.
Okay. Thank you. I know that can be a tough question to answer. So I appreciate you sharing your input. Great. Well, thank you all for joining our session. It was wonderful to have 3 new faces in the FOP community today sharing your insight. And, we try to, like I said at the beginning of the panel, incorporate a new perspective each year. And I think we've definitely achieved that. So thank you for bringing that to our family gathering. And I hope all of our attendees have enjoyed the session. There is another session starting in 5 minutes. So if you haven't already been into the theater to look at the agenda, you can join in 5 minutes our complementary therapies panel, our grief or moving past grief presentation by Sharon Neiman. So please feel free to head into the agenda and check out one of those talks coming up next.